I'm joined now by Dr. William Winkenwerder, who is a primary care doctor and former chief operating officer for Blue Cross Blue Shield, also former assistant secretary of defense for health affairs, and also Dr. Sreedhar Potarazu, who is an ophthalmologist and the CEO of Vital Spring Technologies. Doctors, welcome. Good to have you here.
Thank you.
First of all, I just want to make sure that everyone understands. Basically, if they do this program, it would be in 9 states, and the government would send in basically fake callers who are part of a survey who would call different doctors' offices and say to them, I have this health condition, I'm looking for a primary care physician, how long, how many days would it take for me to get in the door and actually see somebody at your practice? And then there might be follow-up calls to those practices as well. Doctors are very upset about this. They feel that it's an invasion of their practice and their privacy. Dr. Winkenwerder, what do you think?
I think this is a terrible idea. This is not needed. We know there's a problem with access to primary care, and it really feels like snooping by the federal government. And as a former practicing primary care physician, I can tell you I would not like it. And it just fosters distrust between the medical community and the government. We know there's a problem already. And we can go more into that in a second, but
that's a good point.
We know the issue.
Yeah, he makes an excellent point, Dr. Potarazu. Do we really need these callers to know that it's very tough for people to find primary care physicians, and that we're going to add 30 million people to those who are seeking insurance? And no doubt they're going to be making phone calls to places that don't want any more Medicaid or Medicare patients, for starters.
This is going to shock people, but to be fair and balanced, this time I actually favor it, because I think there's a lot that we don't know about what doctors are doing today in terms of how they're deciding who to take on and not take on. And I think it's a major problem, and I think we've got to figure it out. And unfortunately, also as a practicing physician, I think there are major issues in terms of how doctors are practicing today, how they're cherry-picking patients, how they're billing fraudulently. And unless doctors step up to that, we're never going to fix the problem.
Well, that's a very good point. But according to what we're learning about this program, it's supposed to be anonymous. They're going to just call the doctor's offices, and they're not going to report on individuals who decline care. So if your point is that you should be able to find doctors who are, doing things that are at the very least unethical, this program won't help that.
But part of it is to determine in previous points, when they did this in the past with, let's say, people who pretended to be mothers, there was the survey of those that were denying public versus private insurance. And that's part of the question they're trying to go after here, is determining whether doctors are cherry-picking those with private insurance versus those that are on public.
But it sounds like if they do determine that, they're not going to go after these people as individuals anyway. So that raises... Go ahead, Dr. Winkenwerder.
Let me just make a point. They're not cherry-picking. They're trying to make a living. That's what they're trying to do. And the reason it's such a problem, the reason there's a problem with access to primary care is because we don't have enough primary care physicians.
And why don't we have them? Why don't we have enough?
Why do we not have enough? Because we don't pay them enough. They're not paid. And why are they not paid enough? Because the government, the federal government, Medicare and Medicaid, pays primary care physicians at too low a level, and they fix those payment rates for the last 2 decades. It's the government itself that needs to be talking to itself to figure out what needs to be done, and we know what needs to be done. We could improve this by opening up the market a little bit, let people use more of their own money, and I can assure you there'd be plenty of people flocking back into primary care medicine because they could get paid.
It seems like we've worked pretty hard to make this a very unattractive profession, sadly, for so many potential doctors out there, Dr. Potarazu. What do you think about that?
I think it's unattractive for some. I know that some doctors are overwhelmed, and I understand the volume issue. But I have to tell you that the other flip side is there are a lot of doctors today who are charging for so-called level 5 sophisticated visits who never even touch the patient, who claim to have checked your pupils as being equal and reactive, or checking all of your cranial nerves and billing it for the highest level of service. There's a lot of those people, and there's a lot of doctors who are billing fraudulently for patients that are not alive. So I think we've got a whole spectrum there of physicians. Some are clearly being honest that are overwhelmed, but we also have to weed out those who are making it bad for everybody else in charging the system for things that are not happening.
Very good points, gentlemen. And you've been in the trenches of medicine, and you point out that there's a lot of work to be done here. Thank you so much for being here. Good debate.
Thank you.
Doctors, we appreciate it.